Cardiac, the same thing with the cardiac exam. Inspect the precardium first, or the anterior part of the chest. Don't, when they say inspect the precardium, don't get all, they're talking about the anterior chest, and in particular, that part of the chest that lies up under the sternum. So we inspect first, palpate. How many spots on the anterior chest are we gonna feel? Five. Aortic, pulmonic, first point, tricuspid, mitral. And when I'm in this point here, I'm doing two things: doing the mitral valve and the PMI at the same time. The PMI is way down here.
Okay.
That's another course. So
I didn't make it.
Inspect, palpate it, and auscultate it. Same thing, 5 points. Aortic, pulmonic, first point, tricuspid,
mitral.
Flip your stethoscope on this one.
Do the opposite.
Same time.
Because we're going to on the cardiac exam and at the abdominal exam, we do it with both bell and the diaphragm.
How about pulmonary? Just
only with the diaphragm. If you got bruise and abnormal blood flow up here, we got a problem.
A huge problem.
Should be nothing but air up here. That should be. Okay. Same thing with the bell of the stethoscope, aortic, pulmonic, first point, tricuspid.
Are we going to use the two things?
Which one?
Are we going to use one person? Are you going to listen to it at the same time?
No.
Okay.
Just looking for technique.
Oh, technique. Okay. So we have to
I'll
listen to
perfect the technique.
how about blood pressure? Do it.
Automatic.
It's automated.
Oh,
We're trying to make this
No,
as
please, no manual.
stressless as possible.
It's clear.
that's it?
As far as I know, it's automated. We don't have manual blood pressure cuffs. I go around.
Wish you don't.
So that's inspection, palpation, and auscultation of the cardiovascular. And we move down to the abdominal. Inspect the abdomen first.
And auscultate.
And very important, you should be putting an asterisk next to this. Once we inspect, auscultate first. Don't touch the abdomen. How many points?
4.
6.
Six.
One.
Oh, yeah.
Both upper quadrants, both lower quadrants, hypogastric. I'm married already.
Hypo and
OMG.
Same thing. Diaphragm first, bell second. All
Diaphragm first, bell second.
both upper quadrants,
This is blood
lower
flow.
quadrants, hypogastrium, epigastrium.
So you do both front and back of the telescope?
Yeah. That's correct.
Diaphragm first, both sides on the anterior chest, one side on the posterior chest.
Use both sides of cardiac and only use
Diaphragm, sir.
The big side.
Listen.
The big side.
The big side.
So I've inspected, I've auscultated in light palpation,
Do we do
and
deep?
then deep palpation.
Oh, deep.
That's it for the cardiac, for the
When
abdomen.
they're doing the light palpation, you just do that. But when you're doing
Both
the deep,
hands.
don't you have to be laid
Both
down?
hands, yeah, they have to be laying down. Make a note that after you finish the cardiac exam, you're gonna lay your patient down. Preferably with a pillow. We're not gonna have any pillows or anything like that. So
You just don't have to suffer.
pull out the foot portion of the bed, lay them down.
Oh, then when you do the abdomen.
That's right.
The palpitation is, the light one is one hand or two hands?
Just
Both hands.
both.
Even the light one.
Yeah, even light.
So you do both hands. So you do 4 quadrants. Yeah,
The same places, all 6 points.
Okay. If it hurts them, you stop. Right?
If they're hurting, then yeah. You
So
should
just
be calling one of us.
If they're pregnant, oh,
We had too much.
how about
So that's the inspection, palpation, auscultation
Leave yourself
of the
before
abdomen.
this.
Sir?
Before I start doing this.
How about if she's pregnant, like a month, you won't show, right?
I'm pregnant in here?
You never know until,
Maybe it can be 1 week.
it might be this night. Might happen.
Peripheral pulse, which you can do either doing your HENT or doing your vital signs. You do both radial pulses.
Oh, me.
You just need a feel for it.
Oh, feel for it.
You use these two fingers. Your pulse should not be strong enough in your fingers, particularly
alter it.
your pointing finger, to obscure someone else's pulse. Different. It's a different thing in your thumb.
You gotta do it for both of them?
Yeah, because you want to compare both sides, right?
At the same time.
Everything we do, we're comparing both sides because we have two of everything.
Oh, so we, like,
Almost two of everything.
Except something, yeah.
To make sure that it's really the same.
Do one,
Yeah, one month.
do the other. Compare the two.
Oh, do one, the other, and
You can do your count at the same time, which I would prefer for you. If you're doing one, then count the pulses, 15 seconds, multiply by 4.
So we just go
30 seconds, multiply by 2. 60 seconds, 60 seconds.
I'm doing 15 seconds.
If you want to count that. After that, you can do exactly the same thing. After the peripheral pulses, we go to the neurologic exam. Pulses, deep tendon reflexes, bicipital reflexes, with the neurologic cam.
that we don't do that.
Both sides. Tricipital reflex. Just check, because everybody's not going to be sitting. Yes, you have to be sitting. That's right, sitting and legs should be hanging.
My leg hang naturally.
So after you finish the abdominal exam, what are you going to do with your patient?
Say bye.
Come back up, and then you're going to do the neurologic exam.
What?
After you finish the abdominal exam, you're going to come back up, and then do the reflex.
Oh, after they would lay down, they tear.
How do you do that in 10 minutes?
Do the Achilles tendon reflex. Then you do the pulses and the two pulses in the feet, and then your face.
Oh, I remember.
No, it's two.
Yeah, you have to do the pulses in the feet. Two pulses in the feet. Which are they? Posterior tibial and
Achilles.
dorsalis pedis.
So your patient will not walk.
Have a seat, sir.
I told you to stay at the
Take shoe off.
Yeah,
So we do all the reflexes. Don't forget to put your hand on the knee. Achilles tendon reflex, dorsalis pedis, and posterior tibial pulse. On the inside, not the outside. Right behind the big ball there is the posterior tibial.
Can you see? Yeah.
And right on top of the feet, dorsalis pedis. No, you're just feeling for the pulse, making sure that the pulses are there.
so just make sure they active that.
So move, just cover everything. Up it, so that you can see what you're doing.
That's the entire thing. Automated. That's
It might do it somehow. So like,
Done?
Yes.
Listen.